Assalamu alaikum and welcome to a special edition episode of Mindful Matters. My name is Taslim with Fateh and today we are joined by the very respected Dr. Muhammad Arif Tanveer Sahab, who's also serving as the Naib Ameer of the Australian Jamaat, and he's also serving in his professional capacity as a GP. So without further ado, Assalamu alaikum Dr. Sahab, how are you?
Walaikum salam wa rahmatullahi wa barakatuh, Fateh. So, thank you very much for having me today for such important topic.
Definitely. Thank you for Dr. Saab. Thank you for joining us. It is a pleasure to have you on this show. So I'm going to jump straight into it. The topic we have today is the coronavirus and vaccines. If you could please elaborate a little bit about what exactly is in this vaccine, how is it made, and just a bit more information about the vaccine so that the youth can understand better how to make a more informed choice.
So, vaccine basically, if we need to understand first, structure of this virus, COVID-19 virus. Okay, there are different strain. I'm not talking about that one. Currently, Delta strain. If you just consider that's like a small ball, so and then you put some needles there, and this is soft ball, but the needles, so they can cause harm. Okay, so inside the ball there is a genetic code of that virus, and main thing is which is causing a harm is that spikes, we call it. That's the needles. Like I'm just giving some similarity to that ball with the needles stick all around. So basically COVID vaccine, that's the spikes on the shell of the this ball, or the COVID in the case of COVID. So that is the weapon of coronavirus. So if we destroy that weapon, then we can destroy the virus. Virus can't survive without its weapon. So that is called spike proteins. So vaccine, there are two types of vaccine available in Australia. So the idea is that how to destroy this weapon. So one is first vaccine which we received is AstraZeneca. AstraZeneca is basically animal, is the chimpanzee's virus, where it's only cause mild flu symptom in chimpanzees. So it's a very, very innocent virus. So what they do, they just genetically modify and make it very, very innocent virus, so that its genetic material is used, is this virus which infects the chimpanzees. So when it is injected in human being, it will not cause illness, but it will generate the same thing which spike proteins of the coronavirus, they generate, when they enter in the body cells, these spikes attach to the body cells and then introduce and or inject their genetic material into the cells, and they replicate and multiply in copies after the copies they produce of these spike proteins.
Okay, so like inactivated virus?
Yes, so it is an inactivated virus, and this virus, when it's given into the body, so that it also body assume that it is a foreign stuff, so foreign material. So the nature has made up the thing immune response in the human body. So we have an immune system. So make it simple, there are different names there, but for ordinary person, so it's better to keep it simple. So in the immune system, there are antibodies immediate, and there is also memory cells. In simple language, I will say that one. So what happened then when this vaccine is injected, this animal made vaccine, so with genetically engineered, so it is made inactive. When it's injected in human body, so human body then response is that it is attacked, body is attacked by the foreign. So then it activate our immune system. So what happened then? Immune system then produce antibodies and also recruit these memory cells to help to combat this foreign stuff, and then so it generates then immunity. So later on, so when virus attack, so body has already got this weak virus which is in AstraZeneca, we call it. So body then already ready they have some immunity, so they can attack that virus, whatever, and it will not let it to enter in the body cells. It will not let it to make copies and replicate. So it can destroy that virus quicker.
Okay, so that makes it a bit more clearer. So it's like playing a trial match before you actually go and play the actual match. So if you play a lot of trial matches and you practice a lot, then your immune system will actually be primed to be able to go and play the main match, that is in the event that you get coronavirus. So Dr. Sahab, you have mentioned a bit about the inactivated virus type of vaccines, which is the AstraZeneca. Can you please tell us a little bit more about the mRNA vaccine? Because we've heard a lot about mRNA, and I would like for you to elaborate this for the youth, please.
Second type of vaccine in Australia available at the moment is Pfizer, so which is mRNA. Basically, mRNA is this genetic coding from the virus, from the COVID virus. So that modified in the lab, and it's called genetic engineering. So only take the genetic codes, so which produce RNA, and RNA then dictate the cells to produce the proteins similar to the spike proteins. So and then body produce that proteins, and then again immune system will be activated and produce antibodies and recruit that memory cells to get the defense against this foreign stuff. So that's how the mRNA is basically is a genetic code from the COVID virus it's taken, and then engineered genetically. Is the only the message, is that which is code is taken and then dictate the cell in the cells in the to produce mRNA, and mRNA then produce the proteins. So proteins, so this is basically they dictate the cells so what to do, and the protein, these spike proteins, and these spike proteins then generate that reaction in the body, and that's it stimulate the immune system, and then immune system activated. So that's how the messenger mRNA vaccine work.
Okay, so from what I understand from that, Dr. Sahib, is that the inactivated type of vaccines have been in use for over a century now, almost. What I wanted to know was, because this mRNA technology is something new, a lot of my friends, a lot of the youth want to know, is this something safe for us to use?
So because it's a genetically engineered, it's only the code is taken. It will not change any other genetic, the material in our cells. It only related to this COVID. They send a message. It only dictate the cells that thing. This is the thing which this vaccine work. It will not cause anything future harm. So far, there is no such data available that we can say that it will cause any future, especially genetic or genetic related disorders. So unlikely, but so far the data and what the technology is meant for, so it should not cause any future harms or any genetic disorder. Yeah.
Okay, so in terms of changing our genetic code or messenger RNA technology, is this something that can be compared to, for example, epigenetics? So they say that if you smoke too many cigarettes, for example, that has the ability to actually change your genetic code. If you lay out in the sun for too long, that has the ability to change your genetic code. Dr. Saab, is this similar or comparable to those types of changes in the genetic code? Because I see a lot of people that eat too much McDonald's, they smoke cigarettes, and they sit out in the sun for too long, and they do not worry about how that's going to affect their genetic code. But they're very concerned about how the mRNA vaccine will affect their genetics. So is that a comparable, is that a possible comparison?
Yeah, it's a more controlled as compared to smoking and other environmental factors. It is more controlled and tested in the lab, tested on the animal studies. And then it is, human beings are involved after that. There are different stages, for the vaccination program. So it's not straight away, they just made it and then start injecting human beings. So it's not like that. Yeah.
Okay, so essentially it is, in your opinion, more controlled and more essentially safer than, say, laying out in the sun for too long, which can cause skin cancer, smoking too many cigarettes, which can cause lung cancer. So now moving on from that, Dr. Sahib, we all go online, we look at YouTube videos, there's a lot of numbers being thrown around. For example, AstraZeneca 65-75% efficacy, Pfizer 90% efficacy. I just wanted to ask you, Dr. Sahib, what does this efficacy number mean, and does that mean that we should prefer one vaccine over the other? What should we do to make a very informed and quick choice right now, because the pandemic is essentially at our doorstep? So what do you refer in that scenario?
So after 2 doses, both are very effective. Okay. So when I say effective, more than 90% effective. So in terms of severity of the illness, in terms of hospitalization, ICU admission, and death, and also in terms of Pfizer, so the new study, I think it's a Public Health England, probably, if I'm correct. So they, after 2 doses, they said that it is 88%. In the Pfizer, they said 88% effective in terms of preventing the hospitalization and severity of the illness. And they said also, another study is more than 96% effective against the hospital admission, especially the ICU. So that I'm talking about Pfizer. In Israeli study, so recently published, they said that it is 90% effective after the second dose. And in the July data, they published in other things, and they said that against the Delta, because they started Pfizer vaccination quite early, after 8-9 months, they said against the Delta, it may not be as effective. So that is the reason where they started the booster. Okay. But still they are saying that 2 doses prevent the hospital admission and the severity of the illness. And in terms of AstraZeneca, so 2 recent studies I picked up, and but one is that's I think from Public Health England, where AstraZeneca maximum, people they vaccinated with the AstraZeneca. But their study, it is not peer reviewed. There are different stages of study, it goes through different review, and it is not yet peer reviewed, but they just concluded that 60% effective for the symptom wise, to prevent the symptoms related to COVID infection, and 93% effective against the hospital admission. AstraZeneca, they said.
Thank you, Dr. Saab. So now, can you please tell us a little bit about what if, God forbid, someone does contract coronavirus? Is it true that this is an old man's disease? And what are some complications that can arise out of catching COVID?
This answers the question. If you watch even in the media also, and if you go to different health engines, other thing, you will also see that in UK, where maximum people, almost 67-70% people vaccinated, people who stayed behind, they are not vaccinated, they are in hospital. So although hospitalization rate is much less, that's even some days less than 100, and death even some, and they went up to 1,600, 2,000 every day death. And after vaccination, so the people who are vaccinated, so they are not hospitalized, they are not in ICU. Yes, they can contract the infection, but the symptom will be mild flu symptoms. And the people who are unvaccinated, no, they have changed their mind. No more people in UK coming, and similar things happening in USA, where I think that's where many people, they are hesitant with the vaccination. And the people who are vaccinated, so their chances of hospital admission and severe infection much less as compared to unvaccinated. They are more in one state, I was just checking their data, they are more than 90% ICU bed, hospital admission, unvaccinated people. So that is where that will help to change the mind of the people who still are hesitant. And time will come after a few months. We are not far away from these countries. So in another 2-3 months, you will see that people who are fully vaccinated, so they will be much in a comfortable position as compared to the people who are unvaccinated. Basically, they are putting their life at risk, and instead of making a decision 2 months after or ending up in the hospital and then their loved one or their friend, they go for the vaccination. So it's better to come forward, get vaccinated as soon as possible. And that is the message I give to my patient also. And that's the reason I'm very successful in vaccinating in my area, because the people understand the risk involved if you are unvaccinated for some months. If you continue like this, you will be in trouble. Yeah.
So, Dr. Sahab, in terms of an individual, what exactly can COVID do? How does it hurt your body? And what are some long-term effects that can happen?
You are talking about Delta coronavirus. Oh, yeah. Coronavirus is a deadly virus, a respiratory virus. It affects the airway. It starts, from airway it enters, and then it's destroy body organs. So it depends, and because the Delta is so contagious, it replicates so quick, and it produces so many copies and within no time. So it's causing its level in the body is so high, it gets so quick. So then it will not give chance the body to the body immune system to trigger the immune response enough to kill that virus. So because so many copies already Delta virus has produced in the body, person is not vaccinated, person's immune system is not primed, and there's not enough antibodies available to destroy that spikes, the coronavirus spike proteins. So then what will happen is the whole body whole system is affected, and then it's called multi-organ failure. It's not only then respiratory, then it's a blood stream, and then all organs affected, and then every organ when damaged. So although it's called ARDS, acute respiratory distress syndrome, then ultimately the heart fails, kidney fails, all whole system, the body is shut down, and everything is, the body is living in the ICU support is required to even live, to breathe. So it's a deadly, it's a horrible disease. If somebody have seen somebody in ICU, they will understand how deadly this virus. I worked in ICU. I know that when I was in hospital in Glasgow, and I know that how difficult life, even for the doctor, is not easy. Okay, so how to monitor the patients? They are alert. They frequent change of shift to monitor every few minutes to monitor their hearts, and they are of course they are monitored there. Then they check the airway, they check all the input, output, different things to monitor. And in the special precaution they are taking if the person is infected with a COVID infection, and in the ICU, the person they have to isolate, they have to wear PPE, and then it's very, very difficult even to communicate that person, even if it is awake. So it's a miserable life in ICU if the patient has to stay there for many, many weeks. Even one day is very difficult there.
Okay, so that outlines how dangerous the coronavirus is. Now, Dr. Saab, another question I had was, we've heard that when you get the vaccine, you might have got double doses. It still doesn't guarantee that you will not actually catch coronavirus, and you can actually be vaccinated and catch coronavirus and still spread it to other people. So the youth are thinking, in a scenario where you can get vaccinated but you can still catch the virus, what is the reason for us to get vaccinated? Why not just not get vaccinated?
Yeah, that's very good question. So still, yes, you can contract the COVID infection, but it will not cause harm. It is not as severe. It will not produce the symptoms, severe symptoms, respiratory symptoms, and then it avoid hospital admission. And also in some studies say in youngsters, so I'm not talking about above 60, I'm talking about under 60, it prevent 100% mortality.
Okay, so from what I understand, Dr. Saab, essentially, yes, you might still catch COVID and you might still spread it to others, but if you're under 60 right now, the efficacy of the vaccine in terms of preventing mortality is almost 100%. And the vaccine is also very efficient at preventing severe hospitalization, which is something obviously we should all look forward to and make sure that we don't end up being hospitalized. So Dr. Saab, another question that I had is that, is it true that you can yourself be asymptomatic, have no symptoms of COVID and spread the virus to your friends and family?
Yeah. So asymptomatic, yes, it can. First initial strain, even youngster, the kids, they did not get even any symptom, although the test later on showed they were positive. It is the Delta virus, this has caused so much misery now among the youngsters. So after vaccination, so you may not get symptom at all. That is what the vaccination is doing at the moment, majority of the cases. But still you can contract the infection, still you can pass to other people, but less transmissible, less chances of passing to other people, because you are fighting when the virus enters, your immune system destroy it, less load of virus in your respiratory system when you cough, when you sneeze. So less chances that you will spread this virus to other people as compared to if you are unvaccinated, because that if you are unvaccinated, virus will go into your system and it will replicate quick, and more copies produced, and then more you are transmitting to other people. Yeah.
Jazakallah, Dr. Sahab, for all those answers. Another very persistent question that the youth has, or the youth have brought forward, is that these vaccines at the end of the day are produced by Big Pharma. And we've all heard stories about how Big Pharma has been infiltrated with corruption, and they can get together with the government and not always look at the best thing for the people. So the question that we have is that, can we trust Big Pharmacy to develop a product or a vaccine that's going to be injected into all of us, when we know that Big Pharma has in the past done some unethical business practices or haven't always been transparent?
Okay, so I think that is, the research is not dependent on a company. It's not that vaccine, the company does their own research and then it is they start manufacturing in such a scale. So there is a certain the way how the system works. So the company, then there is special the WHO also, there is a criteria, there are many ethical other criteria they have to go through, and then independent research happens. The first is small level, first of course animal and small level in the population, then it's a bigger level, then it's the open to the for everyone. So that is based on that decision is made. It's not in company's hand. Company only they are tool for funding and of course technology, whatever they have, and that is where they earn their profit.
Thank you, Dr. Sahab. I really appreciate you joining our program today. Now, are there any final words you have for all of us that have been in lockdown for about almost 10 weeks now? What would you like to leave them? What message would you like to leave them with?
So message is that do not wait. Do not wait for vaccination. Whatever available, speak to your doctor. So get vaccinated, and as soon as possible. So during the lockdown also follow the rules. What the health authorities they advise you, don't breach any health restrictions.
Okay, Jazakallah, Dr. Sahab. Thank you so much for joining us for this special episode of Mindful Matters. The entire team at Mindful Matters really thanks you for your time. We appreciate your guidance and look forward to doing an episode with you where we're not through Skype. For the rest of our viewers, thank you for watching this very special lockdown edition episode of Mindful Matters. Inshallah, soon we will be back in our studios where we can resume our face-to-face format of interviewing and bringing to you special guests. Until then, please make sure that if you have any questions, you go online at our ask.fm/mindful matters, and that is a platform where you can anonymously ask us any questions you have in regards to whether that's the vaccine or any other questions related to the lockdown, or just broadly any questions you feel like asking us. Thank you very much for watching our program today. Assalamu alaikum wa rahmatullahi wa barakatuh.